and welcome to Perficient's panel on proactive women's health, supporting engagement and health equity digitally. We are so excited to be kicking off National Women's Health Week, and I have an incredible group of panelists here and a great discussion ahead of us. Before we get started, I thought we could do a few introductions so you know who you are talking to. My name is Marlena Verster. I will be your moderator today. I am a senior healthcare and life sciences strategist at Perficient, and my pronouns are she and her. And we're going to go around the screen here. So we'll start with Dr. Kathleen Goss of the American Cancer Society. I'll give you a moment to introduce yourself.
Yes. Hi, everyone. So glad to be here. Kathy Goss. I'm Senior Vice President for Partnerships and Capacity Building at the American Cancer Society. I'm based in Chicago, and my pronouns are she, her, and hers. Thanks.
And Ms. Chandra Craven from Perficient.
Yes, so excited to be here. So good morning. I'm Chandra Craven. My pronouns are she and her. I'm born and raised and living in Boston, and I'm very excited to be talking about my favorite three topics, which are women, digital marketing, and diversity and inclusion. Spent the last 20 years as a digital healthcare marketer, Boston Children's Hospital, Mass General, Boston Medical Center, and really excited to be here today.
Excellent. And last but certainly not least, we have Barbara Rhodes from Becton Dickinson.
Hey, thank you so much. I'm very excited to be here with you. My name is Barbara Rhodes, and I am a senior manager in the home care team at in UCC, or Urology and Critical Care at Becton Dickinson. I come to you with about 25 years of experience in medical device and digital marketing, and much of that towards women of all ages. So thanks, Marlena. Excited to join everyone here today.
Excellent. We're so happy to have you here. And unfortunately, we are missing one of our panelists. Sarah Aurora from Go Health Urgent Care was not able to join us today, but she sends her apologies and wishes us a great discussion. So let's get started. Before we jump in, I do just want to welcome our audience again and thank you so much for taking time out of your day to be with us. We would love to hear from you as we go along. So please feel free to use the chat function. You can ask questions, give insights. We will be keeping an eye on the chat. We've got a few of our Perficient folks in there as well. And we're hoping to have a little bit of time at the end to dig into some of the questions that you might have as well. So with that bit of housekeeping, I think we can get started. And obviously, when we think about proactive women's health, we think about the fact that women are making a lot of healthcare decisions, not only for themselves, but for perhaps their spouse, their kids, their parents. There are a lot of people that one woman can influence in terms of healthcare. And I'd love to dig into that a little bit and think about what are some of the challenges that they face as they're really thinking about healthcare for all these different groups. And Barbara, we'll start with you. I'd love to hear a little more from you.
Sure. We've actually done research recently that showed us that women, that the care of women, right, is a family affair. And so, just like you said, it's one woman maybe, and she's caring for her parent, she's caring for herself, she's caring for her children, and helping her spouse. She's enlisting all of them to help in the process of caring maybe for an aging parent, and really orchestrating behind the scenes. And when it's not her that's orchestrating behind the scenes, then another family member is stepping up to provide that role and serve their aging parent. And that's one of our main focuses, honestly, on our priority products. So that's near and dear to my heart. And she's challenged with, who do I trust? I don't even know that I have options. She's looking out at communities and social networks, and sometimes, especially for the area that we're focused on, which is urology or urinary incontinence, where patients may not necessarily want to talk about that to their doctor. So they're looking online, looking in websites and searching certain terms and things like that, and looking in social communities to see what other people are doing and learning from them. And then maybe they're talking to their doctor when they have problems. So it's on us to make sure we're providing as good, comprehensive information, good information that can answer as many questions as possible to as many people as possible, because you just don't know who might need it. What one of the other things that we heard, honestly, is that um, we were serving a woman, and she did not want us to refer or only speak to caregivers in our
Mhm.
communications. She's like, I'm a patient too, and so yeah, I might be caring for my mom, but I'm a relevant person and I'm a patient too. So we have to make sure our messaging speaks to her in many different roles.
Absolutely. Yeah. Yeah. And it's funny. I kind of, start out with a question on women, but as I think we've all spoken about over the last several weeks, and I think the whole healthcare community has been thinking about, women aren't just one thing. It's not this monolithic market segment or audience. Chandra, I'll pick on you first here. I'd love to think a little bit about how we should be engaging with all women, and what should we be thinking about? Who should we be talking to? What matters to the different groups that kind of comprise women?
Absolutely. So I identify as a cis Black woman in the US working in healthcare marketing. And I've seen firsthand the necessity, but also the lack of thinking about intersectionality and how the one size fits all marketing that's aimed at women, particularly digital marketing, particularly in healthcare, be it provider, be it payer, pharma, or medical device, is still very much aimed, it seems, at one specific demographic. That demographic still appears to be white, straight, suburbanite, generally neither millennial or over 65, even when we know there's an ever growing older population and certainly a more ethnically, racially, gender, and sexual identity diverse America, which is only growing in that direction. We often talk about intersectionality, which I'm going to give the Oxford Dictionary definition of, which is the interconnected nature of social classifications such as race, class, gender. But I'm going to add sexual identity and age here too, because I think that there's
Mm.
real overlap here. I think it's something I wonder as marketers, as we build kind of personas or customer journeys or websites or digital marketing campaigns, do we even think about intersectionality? And what does that really mean for segmenting audiences to address their unique needs? Or do we always fall back on kind of that marketing 80-20 rule? We're going for the 80%, but we don't really think about that 20% as being key and important. And I think that the last part I'm just going to say here, because I think it's a little bit personal for me, is that, as someone who's well educated, worked in healthcare for years and for decades, went to the best hospitals in Massachusetts you could ever get your hands on and have incredible access to healthcare, I was really surprised when I was giving birth to my daughter to find that regardless of my education, my income, my access to care, I almost became part of a growing statistic of 1 in 4 Black women dying in pregnancy and in childbirth. And that taught me a lot right there. So I think, we have to get rid of the mythology of the single woman experience addresses all needs. And we might even need to talk about how we're diversifying how we think of marketing, our marketing departments inside and how we market outside as well.
Absolutely. And I think there's, even their marketing is one piece, but I think when you look, all through the ecosystem of healthcare and life sciences, from research and development down, all the way down the line to, having um, a procedure or a treatment done, there's opportunities for representation all the way through the line, and having the right voices at each step of the line. And I'd love to have Kathy hop in here a little bit and tell us about an initiative that I know the American Cancer Society is working on, and it is, really key in trying to help bring, women into STEM.
Yeah, thank you so much for asking about that. So, the Research Hers initiative, listen, it's something that really speaks to my heart. I'm a former cancer researcher by training. I had a research lab for many years. I was really proud to have support for my research program from the American Cancer Society when I was just starting out my research lab, and I was studying breast and colorectal cancer. And it was really so important to have that investment to really position our research at the forefront of facing the challenges that these fields face. And and so I really, if you take the two things I love, which is, cancer research, and then you take, the other thing is how do we enhance the workforce and support women in leadership, and to pursue careers in oncology. And so that's Research Hers. So this is all about women supporting other women doing cancer research. And so this initiative is really about funding cancer research. It's about supporting women-led research projects. Funding levels are much lower for females. The leadership positions that women hold in oncology, from oncology care to cancer research and in the communities, these leadership positions are few and far between for women. And what we know is that, especially for women that are from underrepresented backgrounds, those backgrounds underrepresented in the sciences, that it's a really tough road in which there are barriers throughout. And so Research Hers is about raising dollars to support women-led research, and in part to support a program that we have worked with multiple cancer centers across the country called She in Oncology for Summer Healthcare Experience. So this is for students who identify as females in high school to really get exposure to what those careers can be. So this is about creating a workforce that really looks like the people that we are serving. So we're really excited about that. I am thrilled that Perficient is on board this year and supporting this initiative. Folks can go to acsresearchers.org. And I know we're also going to put the link in the chat so that folks can go directly to the Research Hers fundraising page for Perficient. And their goal is to raise $5,000 for ACS. And we're so grateful for that partnership and that support, because this is how we drive change. We really have to invest and come together as a ecosystem here to drive the change that we want to see.
Absolutely. That's fantastic. Yeah. And I think we've got the link in the chat if anyone would like to learn more and make a donation. I think initiatives like these, and really working to get representation at every stage, from the provider that you walk in to see to the medical device that was created with you in mind, no matter who you were. I think when we think about empowering women, helping them to be more proactive about their health, I think seeing people on the other side that really reflect them, that's an important important issue. I want to turn our attention a little bit to, we had a really great chat come through in terms of barriers to trust, and I'm not sure who made this comment, but thank you for chiming in. But I thought this was so interesting. It's a barrier to trust, previous societal restrictions on talking about specific women's issues. And one of the things that we've talked about as a group is we've got this, obviously, as we talked about, this, group of women, which are incredibly dynamic and different. But then we also start to think about how ages play in, and generations, and some of the older generations. I think if I remember correctly, all of the baby boomers will be Medicare eligible in the next couple years. Mm-hmm. All the way down to the other end of the line, we've got the older Gen X folks who are just really starting to make their own healthcare decisions. And I'd love to hear from the group a little bit about what are you seeing with those different groups? Are you seeing some of that, those previous restrictions starting to loosen up in the older end of that spectrum? Are you seeing the millennials and Gen Z kind of breaking down the door? I'd love to open that up to you and see what you're seeing.
I can speak to our aging population a little
Mhm.
bit more than the younger, probably, again, just because that's where we focus so much of our attention right now. And what we have heard from our ladies is a lot, like I said earlier, where they don't necessarily want to talk about their issue around like urinary incontinence or very personal things until it's gotten to a certain threshold, right? And so they're living with it and they're dealing with things and themselves and not necessarily reaching out to the medical community until it gets to a certain point. And I think that's the families are stepping in as they're taking care of and stepping in to help that aging parent or aging family member, may not be a parent. They're starting to try to help too, but again, there's still a little bit of that uncomfortableness of who do
Mhm.
I talk to and where do I go and that sort of thing, and which doctor of moms should I speak to because she might have a few. And so it's our I we feel the onus, like I said, is on us to just make sure that we're answering as many questions and providing as much information as we can that's easily findable for
Mhm.
them, so that if for whatever reason we can't necessarily easily engage in social media, we have things out there that they can find if they search. And then we have the systems in place to answer them in a way where they feel comfortable asking questions, regardless of who it is that's helping that parent or aging female. So
Absolutely.
yeah, that's where we are.
And the more comfortable we can make those conversations, hopefully we're kind of closing that gap in, I have a problem and I finally am desperate enough to get care. There's a
Yes.
lot that can be done in that interim to help.
Yeah,
And
and there's options, right? So
Mhm.
one of the things that we heard too in the research we did not too long ago was they didn't know they had options. I didn't know I could use something other than a diaper. I didn't know it was out there, because that's the majority of what people are using, or they've been using that as their condition progressed to be worse, and they didn't realize they had an opportunity to have something else. And the truth is that even in the other end of the spectrum around contact lenses and the work that I used to do on contact lenses, people didn't know
Mhm.
that they didn't have to live with something that bothered their eye, right? Like they didn't know there were other versions of a contact lens available that was more comfortable to them. So I think, again, it's our job to make sure we're putting out as much information as we can that's easily findable so they can be aware of their options, because the providers may not necessarily know or have the time, or patients may not mention it to them that there's an issue.
Absolutely. Yeah, and Kathy, I think you were getting ready to say something too, and I jumped in. Um,
That's okay. And I know Chandra is going to jump in on this one too. I mean, I think this trust issue is such
Mhm.
an important one. And that really hits home for me at the American Cancer Society. We really take pride in being the number one trusted source of information for cancer. But the key is we've got to make it accessible for everyone. And you talked, Barbara, about, making sure people can find it, but it's also making sure people can understand what you're saying
Mhm.
and that
Sure.
it's relevant, that it's culturally um, sensitive and also appropriate, and that we're really addressing your needs,
Mhm.
right? And it's coming at it from multiple audiences. So, like in terms of oncology information, it's about recognizing that sometimes it's not the patient alone that we're trying to reach. We need to also reach the caregiver. We need to reach, those that are impacted
Mhm.
by that person going through a cancer journey. We're also interested in reaching folks along that entire cancer continuum. So people before they have cancer, we want to reduce their risk of cancer, teach them how to lower their risk and prevent the disease. but all the way through treatment and survivorship. So it's also about meeting people where they are and then coming at them and providing that information in multiple ways. You know, whether it's through social media, video, content. For us, content on cancer.org that is really easy to find, and it really answers those top questions that they have. Because when you're going through something so devastating as a cancer diagnosis, you are desperate for information and for help. The last thing I'll just add is to that point of coming at it from all directions. We also are really proud of the fact that we have a 24/7, 365 helpline that people can call at any point. So you're in the middle of the night and you don't understand. You're like up at night thinking about, I didn't understand what my doctor said yesterday. But you can call and actually get someone on the phone or through a chat that really can help explain it for you. So it's really, I think that bit about trust is so incredibly important, especially for those populations that have been excluded and marginalized.
Absolutely. We had a great comment pop up just a few minutes ago about that idea of trust and, kind of giving that content, giving that information in a clear, non-biased way as well. There's no, there's nothing to be gained from giving information that might be a little off. Just the facts, help people to understand, help people decide for themselves. And I think that's so critical. I want to transition now a little bit because Kathy, you brought up some great things about keeping things accessible. And I can, I think we've all been to the doctor at some point in time and gotten told about a condition or something and said, what do those words mean? That's a lot of words. So accessibility is one thing, but I'd love to hear from the group about, what are some other things that we need to be thinking about when we're looking at closing kind of those health equity gaps or reaching people in underserved communities. You mentioned, Kathy, too, social media, being in different places. Is that enough, or is there more that we can be doing to really make sure that our message is getting to everybody, to all of the people that that we need to speak with? Chandra, I'll start with you.
Oh, to that answer, I'd say absolutely. That is one avenue. Social is always going
Mm-hmm.
to be an avenue, but we have to think much broader. If you're trying to reach these audiences that are outside of perhaps a group that you may be a part of, you have to start thinking in perspective and connecting with people who may be from those groups, who can also tell you where are they, what social platforms are they working on. We know for a fact that Black women, for example, are much more likely to use Instagram and TikTok than they would use Facebook. That's a pretty big, important piece of information if you're trying to do some marketing to that group. We want to go into the communities. We want to be a part of those communities, and we want to really start to dig in. And I think to the point that I want to say Dr. Goss made about representation, I really want to stress that because I think going back to trust, the other piece of it is when people see people of like-minded backgrounds as their providers or as their caregivers, they find that connection and they have that trust. Oftentimes, if you're thinking about clinical trials, I've seen this recently on some work that we've been doing on trying to recruit certain groups of people. And one of the things that we're finding is that you really have to think about who's doing the recruiting to which group and which audience, and is that audience going to feel trusting and accepting of the way that you're trying to recruit them and who's recruiting them. We need to start to think about these things before we just kind of jump in and see everything as kind of very much a similar monolithic state.
Definitely. And there's some history too. You really, really need to understand how different, different segments have been spoken with in the past,
Yep.
things that, experiences that they've had, that can automatically bring some distrust into the picture before you even get started. So really taking some time to understand those different audiences is key. Well, one of the things that we learned as we were preparing for this session is that there is a large group of women, a large percentage of women who really do feel like they're misunderstood and overwhelmed um, by their healthcare experience. And I think we've dug into the idea of trust a little bit, but I want to come back to that and think about what are some ways that we can help them, um, in terms of balancing their personal needs with the needs of their family. Some of the issues that we spoke about, and just kind of breaking down healthcare information into something that they can find accessible. What are some of the things that you've seen out there? I'll put this out to the group. And maybe what are you doing as well to kind of help ensure that we're taking women along for the ride, and we're not leaving them behind as they're trying to balance a lot of different healthcare needs.
I can jump in. So one of the things that we've heard and we are addressing is, again, if everything is on the woman to take care of, then she'll get overwhelmed. And if she can dole out some of the responsibilities so that others in the family are helping, and that's what we saw again in the research that we recently did, was the son-in-law or the husband or the son or the granddaughter were all playing a part in the process. And so it was interesting to hear, and also to then recognize, making sure that the messages could speak to any of them, and the information is in a way that it's easy to understand. It doesn't use a lot of terms that are more clinical, but really what phrases and what words are people using in their conversations today to explain their condition and to get through it, and then trying to pull that into how we're answering questions and how we're putting our information out there. I think again, we have to just continue to keep in mind that she could be so many different facets of the process, right? Like, she could be the caregiver, she could be the decision maker, she could be the patient, she could be the provider. She needs answers to the questions, and she's having others help along the process. And so just making sure that it's almost portable information that she could easily share too, and give it to other people, who could be helping along the way also. And Marlene, we even worked with you, right, on it might be that the user is on one device getting information, but
Yes.
the caregiver is on another device buying, right? And so how can they, between the two of them, share so that everybody gets on the same page? And it's really just, it's those nuances, I think, and making sure that we're making it as easy as possible as we can, for them to get the information or to get the help.
That's such an incredible point. There is that community factor, and are there things that we can do? Whether we're in medical devices, whether we're on the provider side, whether we're a payer, to help make those connections easier. If you're making healthcare decisions for your family, for your spouse, how can we help make those connections? I think that is a great comment, and I have to laugh at one of the great comments that came up in our chat, from Melissa. I have doctors spell out the words, conditions, medicines I don't know at the time they introduce them. It sometimes annoys them, but I don't let that stop me. Bravo, first of all, Melissa, to you. But I think one of the things I like so much about this comment is she kind of creates for herself that environment where she can ask questions and take the time that she needs. But when we're thinking about proactive women's health, proactive health, some people have a harder time doing that. And I'm curious, when we think of marketing and what we can do as marketers, are there things that we can do to help people feel more comfortable, whether it's on our websites when they walk in the door? What are those things that we can do to kind of say, hey, you're safe to have that conversation here with us?
Can anyone jump in? I'll take this
I'll
one.
let you jump
Go
in,
ahead.
Chandra.
We have a client that I'm really, really proud of in terms of the work that they did for the LGBTQ, particularly for their trans patients in particular. So thinking about trans women, for example, really looking at their website and thinking about how can they really be more inclusive and how can they make their environment virtually, if not at the physical level, feel inclusive. And so one of the things that they looked at was adding flags to the name of their provider. So like when you did the find a doctor, you could go and actually do a filter to find an LGBTQIA supportive provider. That's a big deal for someone when you're looking for care and you don't have time to figure out whether or not a provider is going to be supportive of you. But knowing someone's been trained, knowing someone is experienced and ready to provide you care, that's a big win. And they've been able to take that and really expand upon it and seeing a lot of great strides out of it too.
I love that. I would just throw in that is so important, and a part of what we do at the American Cancer Society is help provide some of that professional education on some of these topics. We just had a great related to what you just shared, Chandra. We just had a great um, Project Echo. Teach one, teach all sort of learning session for providers, for primary care providers to talk about cancer through for the LGBTQ plus community. And, there are a lot of issues with screening, for example, and reducing cancer risk. And a lot of our providers don't have the tools in their toolbox to be able to do that. So I think to do that well and to make sure that their patients feel heard and seen the way that they need to. So I know I think one of the points I'd like to make is that this just takes a partnership among all of us, right? None of us. These are complicated.
Mhm.
Um, challenges that we all face and barriers to care that women, especially from those populations that have been traditionally excluded. So we have to all come at it together. And so I think, it's healthcare professionals, payers, community-based organizations, trusted community partners like community healthcare workers, and others at the table, again with that patient and caregiver focused lens to really address those big questions. Because when we're talking and those barriers, when we're talking social determinants of health,
Mhm.
these are these are complicated and they are multifactorial, and one thing can impact all these others. And so folks addressing them in isolation, while we're all doing the best that we can, you can't be everything to everyone. So that is, I think, why partnering, leveraging best practices, our expertise, our experience, our lived experience is
Mhm.
just so important, all coming at it together.
Absolutely. Absolutely. That's great. And we've had a couple comments come up in the chat, which I think I want to mention this. I know we're going to run out of time, but I think it's just such an important point for us to at least kind of consider, when as marketers, when we're creating copy, when we're creating content, there is a little bit of a push and pull that's happening. There's I know that this content I've created right here is going to speak so well to my audience. They're going to get every bit of it. And then there's the kind of more clinical side. Well, it's not as clinically focused as it needs to be. And then you've got the regulatory side saying, well, you can't say you can't say that. You have to say this instead. Um, I think that's something that so many of us struggle with in terms of creating experiences that um, speak to the people we intend for them to speak to, and have that clinical voice that our providers or our other clinicians are looking to have too. So I'd love to hear a little bit from you, Barbara. I know one of for on the Pure Wicked Home site, for example, you have a little bit more of a guided experience so that you can kind of balance that kind of patient forward copy with some of the more clinical pieces. But I'd love to hear a little bit how you think about that piece.
Sure, absolutely. It's a great. That's why I was smiling a little bit. Is it's very near and dear to our hearts. We're learning, right? That even some keywords that we have in our names and in our products are not words that people are using, right? And so they are not necessarily registering them as an option for them. Or they're saying, oh no, I'm not using a catheter. No, no, no. And they don't understand that the device itself actually works outside the body and does not need to go inside. And then when you explain that to them, it's like, oh, that's a whole different deal. And I'm much more comfortable with that. Words really matter. And so it's a huge learning for us that we have a big opportunity there to do even more of the work around what are the words that people are using to describe their condition, what is it that triggers for them, and then how can we incorporate that in a more impactful way in our experiences so that they realize that it is for them. And just like you said, Marlena, like even down to we have a tool on the website that is Puric Right for you, and making it as simple and easy for them to get through with a few easy questions, but pointed enough so they feel like we understand them and we're giving them a viable solution at the end, is important. And then trying to make sure again that it's as accessible as we can make it, to folks, in as many places where they are, as well. And yeah, we are very blessed in that, our legal and our regulatory and our medical teams have recently said, yeah, we need more language that, and I'll use plain or common speak versus medical lingo that people will understand. We realize that. Yay! So now we can go and
Yes.
work collaboratively with them to try to evolve our language and make it more approachable for folks, or and relevant to them and relevant to their searches. And we can, the beauty of search, right, is we can see what are they looking up and where is the search volume, and then how can we make sure our language is similar to what they're searching for so that it's more relevant to them.
Absolutely.
It's a great, place to be now that they're on that page too.
Well, great. That is fantastic, and I think there is certainly room for both. There are
Yes.
we did a project recently, speaking actually with Medicare aged folks, and one thing we discovered is there are the people that want to be taken by the hand and have
Yes.
really accessible plain language. There are still people out there that want to read every little word you put in front of them, even if
Yes.
they don't understand what it means. They're going to find out.
Yes.
So there's, there is
It's
that
a
space
balance.
too for a little bit of everything.
Yep.
Well, we are going to rapidly run out of time. So I have one more question that I want to ask the group. And for those of you who there's just been such a great chat happening, with our audience. So I know there are some questions that we're not going to get to, but I think this group can get together and maybe come up with some answers that we can pop on LinkedIn. But to kind of start to close us off, I'd love to talk a little bit about how you are building relationships and loyalty with your different segments of women, and I'll start with Chandra and
Sure.
a little bit about the work that you're doing to kind of be inclusive
Oh, absolutely.
and keep the conversation open to all.
I think the first and foremost is we have to be implicit and purposeful when we are talking about diversity and inclusion. We've made it into such a buzzword that we've taken the meaning out of it. And so we're not living up to it very often. So I think in the work that I do, whether I'm building a persona, we build these sandwich mom personas all the time and they become very generic. And I always see the same, and it's, let's just put a Black woman's face or a Latino woman's face on something and call it the sandwich mom, and I'm like, do you know for a fact that that's who she is? The idea that you can just slap an image on something and call it diverse, it no longer applies. It no longer works. But I would say the biggest thing that I also do is take into my work is help my clients understand that digital is this amazing tool that might actually do something that we have not been able to do as a society, which is do the segmentation that we need to do and reach different audiences in the way that they need to be reached. So you have one message, but you're going to have to break that up into 15 different ways so it becomes relevant and important and accessible to those 15 different audiences. That might mean more work for you, but in the long run, you reach all 15 of those
Oh yeah.
audiences.
And those little nuances, those little differences between the segments, that's where the good stuff is.
It really is.
That's where you really can I think just hit home with someone. Kathleen, what about you and the American Cancer Society? Where are you kind of focused in terms of building relationships and awareness and loyalty?
Yeah, that's such an important question, and so much of what Chandra said, really resonated with me and the work that we do at the American Cancer Society. Listen, health equity and the health inequities that populations and communities face, that's really foundational to the work that we do. Everything we do has to be looked at through that lens, because if we're not addressing the barriers to care that folks face, or the getting the right information to individuals, or making sure that we're building that diverse pipeline that will address these problems in a sustainable way, or advocating for public policies that create that sustainable change, then we're not doing our job. And it's the partnerships. I'm glad you mentioned partnerships. That's key for us, and it's at all levels. It's with healthcare systems. It's with communities. It's with, at the national level, at the state level, at the local level. So we're really, incredibly committed to driving change, but we need all voices at the table. And through a lot of those partnerships, that's how we're engaging various stakeholders. And a big part of this is about listening, making sure that solutions are coming from the community and then being implemented in the community.
Absolutely. I love that you brought up listening. I think that is key. Listening and really being able to understand and have that empathy, that even if you haven't lived some of the experiences that you're hearing about and learning about, you can at least have that empathy to be able to do something with them, and to try to action that in some way in the work that you're doing. Barbara, I'll give you the last words in terms of building loyalty and trust. You've already talked quite a bit about the work that you're doing, but anything that you're looking forward to in the future as you continue your digital journey with PureWick?
Sure. Well, we have not only work to do on evolving our content on our site, but further leveraging basic tools, email, text, and then making sure that the content is relevant and answering common questions and giving them a feedback mechanism back to us, and then showing them that we're responsive to that feedback. Those are big opportunities for us, and we're working through those. Definitely in some areas it's a crawl, walk, run type thing, where we're just trying to get the basics right and work them smooth, and then evolve from there. And we're excited to do some of that based on the learnings that we're getting from our potential customer or consumer audiences, as well as our user audiences, and how can we grow and evolve based on what we're hearing there. We're definitely a research or data driven team, and I know that's an overused term, but truly it's something that we live by and are trying to evolve based on what we're hearing from our communities. So we're excited to I feel very fortunate to work in a digital space where we can be nimble and we can evolve, right? And we can look at where we're succeeding and where we have opportunities to tweak and build up more relevant information for folks and help the business continue to grow. So
Absolutely.
yeah, thank you.
Yeah. Digital tools that really can help promote that connection and
Yeah.
build that trust. Fantastic. Well, we have reached the end of our time. That went by so quickly, but great discussion. Thank you so very much to Barbara, Chandra, and Kathy for joining us today, and to all of you out there who took some time out of your day to chat with us. We sincerely appreciate it. Thank you for joining us, and we will see you next time. Thank you so
Thank you all
much.
very much.
Thank you.
Thanks. Take
Bye,
care.
everyone.